Let's go over to Anambra State and the efforts there at stemming the pandemic. Dr. Vincent Opala, the Commissioner for Health, Anambra State, joins me now from the capital. Welcome to the program.
Thank you.
First, tell us about the strategy for winning the COVID-19 war in the state. How has the state navigated its way in reducing community transmission?
Thank you very much. So what we have done as a state is actually to make a response very, very strategically, reduce the spread of disease in the state. Now, we adopted a COVID-19 chain of survival, which is a 6-linked chain that has helped us actually improve the chance of survival in the state while decreasing transmission. Now, looking at that those 6-link chain, the first link in the chain is compliance with the COVID-19 protocols and vaccination. So the number of people that comply with the protocol, the increase in chances of people surviving the pandemic. Now, the other one is early recognition of symptoms. We've tried to communicate that down to the grassroots. And then early identification with the system. There is early diagnosis and initiation of treatment. Then the fifth one is early initiation of contact tracing. And then early notification of results to the patients and initiation of treatment. So when you look at these 6 links, what it has done for us is that we've tried to decentralize surveillance, sample collection, and all those down to the 21 local government areas. So what all this does is actually to help us onboard people early to treatment, start early diagnosis, and all those. So when you do that, it helps bring down the disease burden in the state. And what we've noticed currently is a downward trend in disease in the state.
Tell us about the initiative, Igwe Buike. I mean, you talked about the principle of herd immunity, but with the vaccines you've received and based on the state's population, how far can you get?
Well, we got 78,810 doses of vaccine. We're about 5.5 million people in the state, so it barely scratches the surface. But the concept of Igwe Buike actually is the concept of herd immunity. If you vaccinate only one citizen, that's not going to be good enough. The more the number of people we vaccinate in the state, the greater the chances of stamping out the virus. So we've tried to preach this concept. When you look at some other vaccine-preventable diseases like polio or measles, with measles, you want to hit 95% coverage in the community for it to achieve herd immunity. With COVID-19, we don't know yet what that means in the scientific world, but we know that the more the number of people that you vaccinate, the greater the chances of keeping the virus away from the system. So that's why we encourage our citizens to come out en masse to get vaccinated. And people are responding and responding well.
The IPC trainings for health workers, I mean, does that also include addressing those who are hesitant to receiving the COVID-19 vaccine?
So with IPC training, we started IPC training for health workers before the index case in the state, April 10, 2020. And we've continued IPC training. And it's something every public hospital has an IPC focal person. The state has an IPC focal person, and this has been cascaded down to every public facility. And then the private facilities has also been engaged in the IPC training. So because this basically will help us decrease the spread of this disease in the health community. And with respect to acceptability of the vaccine, we've tried to communicate to people. I know the initial scare against Oxford AstraZeneca vaccine. We try to communicate to people that correlation is not causation. We try to communicate WHO's message that this medication is, this vaccine is safe, and we've tried to communicate that to our people. And we are noticing increased acceptability among our people. The vaccine is safe, and we also went ahead to create an online form that people can go to this online form after post-vaccination and report any side effects that they notice or any adverse effects. And it's real time. So this is actually nested on the state website. So it helps them to actually know that we're not just giving the vaccine, but we're also following up on them. And we have seen a lot of leadership in the state. The state leadership have come ahead to offer to take the vaccine. And we've seen a lot of leaders. Like today, we have our royal fathers, the traditional leaders in their numbers. They came out to get vaccinated. So the leadership we are seeing in the state is truly amazing. And then among our healthcare workers, they're coming out in mass to get vaccinated too.
Just before we let you go, just before we let you go, Dr. Okpala, and this is with regards to the phases for rollout, does that also include representatives for the National Sports Festival in Edo State?
Definitely, we'll be vaccinating those. We have about 150 of them going for the sports festival, and their vaccination starts tomorrow.
We appreciate your time. Thank you so much, Dr. Vincent Okpala, the Commissioner for Health, Anambra State. Thank you for joining us on the program.
Thank you so much. Thank you.
We have more stories on the COVID-19 updates when we return. Please stay with us.